Hey, Sal Gayton, director of the Pinhole Academy, and we tonight are here at Wade Dental in Cerritos, and we have a great event. We have doctors coming from all over to see Dr. Chao talk about the Pinhole Surgical Technique, and we have our special guest, Dr. Rudy Gamarnik, periodontist, who took our very first course in 2013. He is going to be a patient and have the Pinhole Surgical Technique done tonight by Dr. Chao. Stay tuned for the results. Before we start, let's get a word with Dr. Rudy Gamarnik about his upcoming pinhole procedure.
I'm Rudy Gamarnik. I am a periodontist in Orange County, California, and I have been Pinhole Certified 10 years now. I actually took Dr. Chao's very first pinhole seminar, and here we are 10 years later, and I've done hundreds of teeth, if not thousands, and now this is my first time being a pinhole patient, so I'm a little bit excited for that. Pinhole Surgical Technique, I was a little skeptical at first, and Dr. Chao 10 years ago said, do it for 10 years, you're going to have 10-year cases, and I didn't believe him, and here we are. I have cases that are 10 years old that are just as good as the gold standard of the connective tissue graft. Pinhole's amazing. My patients love it. When I compare the two procedures, 10 out of 10 patients pick the pinhole over the connective tissue graft. I have done split mouth techniques, one side pinhole, one side connective tissue graft. Pinhole patients, happier, faster recovery, less trauma. They just love it. And I've had so many word-of-mouth patients that will come to me strictly for pinhole, where they have gone to other periodontists who are not pinhole trained, who have been diagnosed for connective tissue grafts, free gingival grafts. They come to me strictly for pinhole, seeking out pinhole. It's been wonderful for my practice, both from a professional point of view and from a financial point of view. Favorite cases are always the aesthetic ones, you know, the ones that patients come to you with long roots that have been unaesthetic for years, and you get that immediate gratification. I have a case of a lady. She's going on probably about 9 years after pinhole right now, and she was one of my first few cases, and she was post-orthodontics, which orthodontics sometimes do cause gum recession. And every 3 months she comes for her maintenance, and she every 3 months tells me how happy she was with her decision to go through pinhole. Those are the cases that make me happy as well. I feel like I've done a service to the patient.
Hey doctors, we have Dr. Chao live with Dr. Gamarnik in the chair doing the Pinhole Surgical Technique. It's fantastic.
It's a little bit different on the other side. It's actually easier. All I have to do is go to my happy place. Much faster than I thought. I didn't have any pain during the procedure. We will see once the anesthetic wears off, but it was much easier than I thought it would be.
Hey, that was a phenomenal surgery on Dr. Rudy Gamarnik. If you want to become part of the Pinhole family, click on pinholeacademy.com and become one of our Pinhole Certified dentists.